Welcome to Chillin' 101. We hope this video helps.
You're ready to begin. Pair a compatible Bluetooth upper arm cuff with your iPhone and permit health access. Once paired, open the Cuffs app and choose the option to calibrate with Apple Watch or Health. Sit upright, feet flat, and rest for 5 minutes. Make sure your sleeve is loose and the cuff is placed on the bare skin at heart level. Start the first reading on the Cuff app while keeping your wrist relaxed so the Watch and Health app can record synchronized baseline values. Next, perform the calibration set. Take 3 cuff readings about 1 minute apart while your watch and iPhone remain nearby. Once done, let the cuff finish each inflation/deflation cycle and do not move or speak. This reduces artifact and improves the watch's correlation to the validated arm measurement. Make sure the Apple Watch is worn correctly, snug but comfortable, on the wrist the app expects. After the third reading, confirm the app saves all values to Health, so the watch can learn the relationship. Finally, use the watch to view estimated blood pressure or trigger readings as the app allows. The watch relies on the previously saved cuff calibrations and Health. Once done, repeat calibration routinely, every 4 to 6 weeks, or sooner if you change cuff size, gain/lose significant weight, or change blood pressure meds. If results are inconsistent, recalibrate, confirm the cuff sits at heart level, check battery and Bluetooth, and make sure the Cuff app still has health permissions. That single troubleshooting step fixes most.
Thanks for watching. Consider subscribing if we helped you.